Healthy Aging, The Importance of Physical Activity by Jorge Salmeron-Bernal. The problem: less than a third of senior citizens in the United States report meeting recommended physical activity levels. Inactivity is a major contributor to non-communicable diseases in the United States. It also has major implications for increasing healthcare costs attributed to these diseases. The significance to community health is that medical expenditures are the highest among older adults. The U.S. population over 65 is expected to double over the next 40 years. Because of all the issues listed, promoting physical activity in seniors is very important. Medical expenditures is the highest among seniors. Learning needs assessment. Learning needs will be assessed by conducting sample interviews of community members on the following areas: knowledge of the benefits of physical activity, knowledge of the efforts to promote physical activity, such as asking if they are aware of any physical activity programs in their communities. Environment, such as current physical condition that either allows or prohibits physical activity, along with neighborhood walkability and climate. And resources. Lastly, resources or socioeconomic status plays a role in the amount of physical activity, as I mentioned earlier. Because of the increase in senior population in the next few decades, we must determine what are the major roles in impeding physical activity in seniors so we can discuss and address these issues. Health promotion model or self-care model. This is based on the philosophy that all patients wish to care for themselves. Basic conditioning factors. These can include age, gender, developmental state, health state, social cultural orientation, healthcare system factors, family factors, environmental factors, and resource adequacy and availability. As a nurse, we must identify self-care deficits, provide healthcare agency. Our intervention should include steps for patients to become independent and meet self-care needs independently. The nursing agency should guide the patient in meeting therapeutic self-care demands and or develop their own self-care agency. Their therapeutic self-care demand is totality of self-care actions to be performed for a duration in order to meet known self-care requisite by using valid methods and related sets of actions and operations. Health promotion and health education plan. Goal: to increase physical activity in seniors. Objectives: increase and maintain physical well-being, increase and maintain cognitive functions, increase and maintain mental well-being. Enhanced physical activity enhances cardiometabolic markers, lowers resting blood pressure, and decreases the risk for diabetes mellitus type 2. Flexibility and strength training is recommended to increase mobility skills and reduce the risk of falling. Also, the World Health Organization recommends that older adults aged 65 years and older engage in at least 150 minutes of moderate intensity aerobic physical activity weekly to maintain health benefits. Increase and maintain cognitive functions. And another objective will be increase and maintain mental well-being. Positive mental health and cognitive effects of exercise have also been described. Education methods and tools. Brochures with educational information, and group exercise classes such as group yoga or group walks. Physical activity can be conceptualized as key health resource for aging communities. Enhanced physical activity reduces risk for many chronic diseases and injuries. In addition, physically active persons play more active roles in respective communities than those engaged in less physical activity. Physical and leisure activities in a pleasant atmosphere can be effective for preventing of cognitive decline. Older adults are not participating in sufficient amount of physical activity and not meeting the recommended daily intake of fruit and vegetables. Even regular physical activity and nutritionally balanced diet play a preventative role for many chronic health conditions. Despite the well-known importance of physical activity in the maintenance of physical, cognitive, and emotional health throughout the later years, older adults remain the least active age group in the United States. Evaluation of physical well-being. Evaluate the physical function of each participant using a grip test, time up and go test, 5-meter maximum walking times test, and functional reach test. Evaluate cognitive functions. Evaluate using the 5 cognitive tests, which evaluates attention, memory, visual spatial function, language, and reasoning. The 5 cog test consists of 5 items. Character position referencing tasks to evaluate attention. Category cued recall tasks to evaluate memory. Clock drawing tasks to evaluate visual spatial function. Animal name listing tasks to evaluate language ability. And analogy tasks to evaluate abstract reasoning ability. Evaluate mental and emotional well-being. Evaluate their subjective health status with the questions: how is your health in general? And scored using a rating scale from 1 excellent to 4 poor. We'll do this at the beginning and again at the end of the study period to evaluate what they perceive as their health status. Social support will be evaluated with the Lubman Social Network Scale revised, which would reflect social isolation in older adults by measuring the perceived social support from many family, friends, and neighbors. Conclusion. Factors associated with the lack of physical activity include fear of injury or pain, self-motivation, lack of time, enjoyment of physical activity, social support, neighborhood conditions, weather, expense, accessibility, and convenience of classes and facilities, and characteristics related to self-efficacy, such as confidence, expectations, and perceived support. Our research shows that promotion of physical activities in seniors always yields positive results, but these benefits are reduced with time or if no follow-ups are conducted. What I would do is implement quarterly follow-ups to ensure that senior citizens continue to engage in physical activities. Follow-up time frames would depend on resources available. Thank you. This is a list of the references that I used and the end. Thank you.